Right, obviously. So I want to ask you guys a question. If you were to grab the immune system, what would you put your hands on? The gut.
Your gut.
Gut. Okay, good job. Yeah, that's where most of it is. Not all of it, but yeah, most of it. So when I was in chiropractic school back in the 70s, late 70s, we studied things like the Peyer's patches, which we'll get into in just a minute, in the large intestine, which is where most of the immune system is. But I never, ever, ever remember anyone saying that was where the immune system was, because I don't think we knew back then. Mm-hmm. I mean, there's a lot of things we didn't know in the 70s. Like, I could talk about nutrition for a long time. Mm-hmm. We didn't know much about that. So I don't think we knew much about the immune system either. And we certainly didn't know much about the gut and how that worked. So you can have a strong immune system, and you have to be willing to work for it, okay? Now, what was the event that really exposed the immune system? What?
Pandemic?
Yeah, the COVID pandemic. That's exactly right. Exposed a lot of things. And what do you think that exposed? What could we derive from that?
People's lack of understanding?
That'd be one thing.
Not very healthy.
Yeah, you're getting really warm. Yeah.
I can't hear.
What?
I couldn't hear. What did they say?
She said lack of being healthy. Yeah, that's pretty, you're really warm. I would say what it exposed is essentially our country, the immunity of our country is bad. It's not good at all. And that's why we had this pandemic that was able to sweep through the country, put a lot of people in the hospital, and cause a lot of other problems. Because we're not a healthy country at all, okay? Now, what would you say, if you were to just say, like, what was it, and I'm not gonna talk a lot about COVID here, but it's so enmeshed in, the whole immune idea. What do you think was the primary problem that made Americans unhealthy during COVID to where they were so susceptible to that?
They stayed locked down?
What?
When they stayed locked down and didn't go places?
I would say what I wanted to ask is, what was a primary problem that people were dealing with in their bodies that allowed the epidemic to just sweep through the country? Anybody?
Bad diet?
Okay, you're getting warm.
Obesity?
Okay. What?
Obesity?
Obesity, yeah.
Insulin resistance?
Yeah. I would say all of that. I was thinking inflammation. Most people in our country are terribly inflamed because of obesity and insulin resistance and bad diet, okay? Just inflammation in general. And I do inflammation markers in my blood where I can't believe how inflamed some people are. I'm thinking, how are you walking around anyway? That's kind of what I think about some people, the way they put things in their grocery carts. If you're going to eat that, how are you been able to push your cart? I don't tell them that. I don't want to start a fight in the store, but I think it. Okay. So there's essentially three parts to the immune system: the innate immune system, the adaptive immune system, and the gut barrier and the microbiome. These are three areas of the immune system. Here's a little chart that shows, like, this is just kind of shows the delineation of that. But let's look at the innate immune system. So where do you see the innate immune system really coming into play? Where do you see it? Like, I'm giving you some things up here that shows what it is, but instead of me just kind of reading through all of that, where do you see the innate immune system in an individual really working?
Get a cut?
Yeah.
Exposure, acute.
Good job. Yeah, getting cut, getting sliced, okay? So when you get cut, okay, or you're bruised, or what happens? You get white blood cells that go to the area and they want to stop that from getting worse. That is the innate immune system in action. Where's another example of the innate immune system in action?
Maybe sneezing or something, the nose or something.
Yeah, so how about if somebody sneezes in your face? How about a kid that's sick that coughs in your face? That'd be another example of the innate immune system, your body needing the innate immune system to be strong. How about doctor's offices? How many sick people walk into doctor's offices? It happens every day, okay? Why isn't everybody sick? Why aren't the nurses sick? Why aren't the doctors sick? Okay? Because they need their immune system to be strong. I don't know if they are or not. Their immune systems are strong, but we try and keep them strong in this office, that's for sure. So the quality of one's diet and nutritional status is crucial to the initial or the innate immune response. And here's the issue right here, a big issue, and some of you guys got this. A diet high in refined carbohydrates, fast food, and highly processed food will really blunt the immune response. What percentage of processed food does the average American eat in our culture? Do you have any idea?
90%.
That's some people probably do. That's not the average. That's pretty high, you know. But yeah, there's probably some people that do. Well, some of the people I see walking around with their carts, it's about 90%, but it's about 73%, which I think is extremely high. 73%. This is food that really doesn't have a lot of nutritional value when it comes to keeping you healthy. All right. So low vitamin, mineral, and nutrient status will blunt the immune response. So you get a lot of vitamins and minerals with a Cheeto and Coke? No, well, come on. No, you don't, okay? Contrary to what Sir Paul says over there, you don't, all right?
Because you don't stop with one Cheeto, you eat more.
That's a problem, I know. So, you know, with Cheeto, so look at this. Dietary sugar, 1 can of soda. This is a study that was done, the American Journal of Clinical Nutrition way back in 1973. Reduced white blood cell activity by 40% for 5 hours. 1 can of soda, okay? So that was a 12-ounce can, all right? What about these people drinking like these big gulps, you know, 44 ounces, practically drowning themselves in Coke? So, yeah, soda really blunts the immune system a lot. All right, so this is obviously processed fast food equals poor immunity. Here's an interesting study. It showed that a chiropractic adjustment ramped up the white blood cell count by about 30%, 15 minutes. Okay, so when I adjust you, we are working on your immune system. And people used to call me, you know, when COVID was in full swing, and, you know, is it okay if I come in, you know, I'm sick, I got COVID, and I said, get into the office and let's adjust you, let's upregulate your immune system, okay? That was my advice to them, all right? Chiropractic adjustment, we know, enhances the immune system. By the way, what's the mechanism for that? What's it going through? What is it, how does that work?
Your nervous system?
Yeah, good job. That's a simple, correct answer, through your nervous system. Right, that's exactly how it works. So let's look at the adaptive immune system. It's also referred to the acquired immune system. This is the one that vaccines exploit to build immunity to a certain thing that may be going through the area. You know, like flus and things like that. What it does, it allows the body to remember whatever you've been vaccinated with. Here's the thing, is whatever you've been vaccinated with may not be the thing that comes around 6 to 12 months later, okay? It may be a mutated virus or mutated bacteria. Also, think about this. How many of you had chicken pox when you were little? Okay. How many had measles when they were little? Okay. Did anybody ever get it again?
No.
No. No, I had it. Remember when we were little, they used to have chicken pox parties? They used to get all the kids together so you get the chicken pox, everybody get it at the same time. Because people knew back then that once you had it, you got a lifetime immunity to it, okay? So when you get something like COVID produces antibodies that helps your immune system, okay? If you have a really poor immune system, you may get COVID again. Now, how many of you know people that got the vaccine and the boosters and still got multiple
Yes.
rounds of COVID? Yeah. I was at a family reunion a couple summers ago, and I was listening to my some of my relatives that are about my age talk. I didn't say anything, but one of them said, I had all the vaccines, all the boosters, and I still got COVID 5 times. I mean, what does that tell you? Doesn't work very well, right? Okay, so the innate immune system or the adaptive immune system is a backup system to the innate immune system. You can't count on the adaptive immune system for really high-powered immunity. I think of the innate immune system as the 900-pound gorilla of the immune system. So the immune system is constantly looking for danger signals in the body. It recognizes parts of microorganisms that shouldn't be floating around in your blood, okay? And it looks for other non-infectious danger signals like injury to tissue, damage to tissue, necrosis, dying tissue like frostbite, gangrene. These are major signals to the immune system to try and clean that up. So the greater the danger, the greater the immune inflammatory response. So if you have cellular tissue that's dying from trauma or toxicity, that's a major danger signal right there. So stress. Anybody here know people under stress? I know none of you are, but there are some people out there like that, okay? So chronic long-term stress can cause a down-regulation of the immune response. What else does chronic long-term stress do? What are some of the other things that it does?
Affects your adrenal glands.
Yeah, it down-regulates adrenal function, it causes your blood sugar to go up, increases inflammation, all kinds of things, okay? So your immune system is affected by the amount of stress you're under. And anybody in here ever been in a really stressful relationship that just made you sick a lot? Probably have, okay? Yeah, I have. And so, stress definitely affects the immune system, okay? So with stress, you want to address things like your hypothalamus, your pituitary gland, and your adrenal glands. Okay, so here's a stress response. Stress response goes to the adrenals. It produces cortisol, which causes an immune response. So higher chronic unrelenting stress is equal to poor immunity. Here's another interesting study: chiropractic and adaptive immunity. So this is a journal called Acta Biomed, which is short for something. I didn't look it up. But here's the interesting thing of the study: chiropractic adjustments lower cortisol and help reset the autonomic nervous system. So here's the name of the article: Neurological Basis of Chiropractic Manipulative Treatment of the Spine in the Care of Major Depression. And they were looking at what does a chiropractic adjustment do to cortisol levels, and it helps reset it. It helps balance it out. Now, if you're incredibly stressed out and you've been that way for a long time, you're going to need something other than just getting adjusted, which is very powerful, but there's probably some nutritional things you're going to need as well. Now, here's the third part of the immune system: the microbiome, or the gut environment. So approximately 70% of the immune tissue is located in the intestines, primarily right in here along the lower right side, okay? Well, on the right by the ileocecal valve, the cecum and the appendix, ileum, cecum, and appendix. And I see a lot of ileocecal valve problems in the office, and that can be certainly tied into the immune system. So the gut, the Peyer's patches in the gut, the immune system in the gut communicates with the brain via the vagus nerve. Okay, and I do an entire separate talk just on the vagus nerve. You have this one nerve. You have two of them that come out of your brain right here, come across here, down your throat, and innervate the upper 2/3 of your GI tract. That nerve communicates with the brain. It lets the brain know what's going on with the gut and the immune system.
You said something, ileocecum.
Ileocecal valve.
What does that go from where to where?
Okay, good question. It's a valve that separates the large and small intestine. There's a valve that opens and closes, and that gets dysfunctional a lot. You can get dysfunctional with stress, with diet, like popcorn for a lot of people is really bad for the ileocecal valve. Gluten, it can get dysfunctional from just getting hit there. But I fix it a lot, okay? I fix it pretty regularly. There's a problem with it in people. It can cause all kinds of weird things in the body, headaches, ringing in the ears, all kinds of things. So here's the ileum. Here's where we're talking about this part of the body is where a lot of the immune system lies, right there. So this is just a diagram explaining how the gut-brain axis works. So let's talk about the human microbiome, okay? It's, if I were to ask you, what exactly is a microbiome, what would you tell me? Somebody asked you, hey, what's a microbiome? What would you tell them?
The bacteria in your intestine that causes digestion.
Yeah, that's a pretty good answer. Yeah, it's the gut bacteria. It's your microbiome, okay? And it's primarily non-pathogenic bacteria and viruses. In fact, we have more bacterial cells in our gut than we do in our entire body by about a factor of 10, okay? So primarily non-pathogenic bacteria, although you have pathogenic bacteria in the gut that's necessary, but it's the non-pathogenic bacteria that keeps it from overgrowing and causing problems. So your gut bacteria is basically an organ, okay? It acts like an organ. And it provides vitamins, nutrients, while digesting your food. So it in the process of digesting food and eating like some of the fiber that you give it, which hopefully you are, it produces a lot of nutrition in the body. So the relationship between the immune system and the gut is pretty amazing, actually. So certain bacteria can increase T cell production. Your T cell is one of the cells in your body that's part of the innate or the adaptive immune system. Short chain fatty acid butyrate from high fiber vegetables and some fruits promotes healthy release of T cells in the colon, and the body converts fiber to short chain fatty acid. So this is why eating a healthy diet that's high in natural fiber is so important, because your body, your gut bacteria produces this, which actually helps your immune system. So more T cells means less inflammation and fewer intestinal dysfunction. So what are some of the really good foods for producing this? What are some of the good foods for feeding your gut?
So I got a quick question. So fiber to help with constipation and pushing things through, but it also makes the butyrate.
Yes, ma'am.
So
Exactly right.
the fruits and the vegetables, so there's a double reason for eating it.
Absolutely. So there's lots of good things that will do that, like, eating grapefruits. That pulp is really good. Avocado is really good. There's so many things that you can eat that your body uses to produce that. And we need that in our body. You know, when you eat like a sack of Doritos, that doesn't do this, okay? I promise you that, you know. In fact, it's gonna make you constipated more than likely, more than anything.
Yeah.
So it doesn't do any of this. You actually need real food for that to happen. Here's another interesting study. Short chain fatty acids in human gut and metabolic health. Evidence is accumulating that short chain fatty acids play an important role in the maintenance of gut and metabolic health. The short chain fatty acid acetate, propionate, and butyrate are produced from the microbial fermentation of indigestible carbohydrates and appears to be key mediators in the beneficial effects elicited by the gut microbiome. So we need those short chain fatty acids, and you get those from the food you eat primarily, or at least the bacterial action on the food that you eat. So what are some of the causes of dysfunction in the gut? High sugar, bad fats, okay, like as in Hostess Twinkie, okay, as in McDonald's French fries, as in, you know, donuts from wherever, Hertz Donuts or wherever, doesn't matter. Inflammation, toxic exposures. This is a huge topic, and I do an entire talk on that. I'm going to redo that talk and make it a lot better, and we're going to do that later this year, but toxicity is huge. It's a huge issue. Emulsifiers. Where do you get emulsifiers?
Toothpaste.
How do we consume those?
Toothpaste.
Toothpaste, yeah.
Yep.
That's why I don't use toothpaste. You get Crest and Colgate and all that. They have emulsifiers, and that's what causes a lot of the foaming, you know, when you brush your teeth. So I never use toothpaste.
I have a quick question. The toxic exposures, is that like what's an example? I mean, or you mean like smelling diesel fumes or what?
Yeah, that would be one. Or how about like pesticides? How about herbicides? How about molds? You know, being in a moldy environment. How about glyphosate? Yeah. How about like heavy metals from, you know, I mean, you know, I just did the toxicity test on myself and I was high in arsenic. Where was I getting that? Well, we eat a lot of rice at our house. Rice uptakes arsenic, so we're not eating it anymore. Not very much of it, that's for sure. So, you know, you can get it from a lot of places. You know, loss of fermentable fibers, antibiotic use. Antibiotics basically carpet bomb the GI tract. And I know that antibiotics save lives, saved a lot of lives. But what's interesting, I don't have the book here. I wish I would have remembered to bring it. There's a book that I'm going to recommend called Blind Spots. It's by Marty Makary. Did you read that? Have
It's
you read
on
it
my
yet?
list. I haven't gotten to
Yeah,
it
well, I
yet.
started it, so I'll tell you about it after.
Okay, sounds good.
So Marty Makary, great book, and what he basically says, he has a whole chapter in that book that says the overprescription of antibiotics in America has caused a lot of the health problems that we have today. This is a surgeon at Johns Hopkins saying that. He says a lot of other things in that book that are pretty interesting too, but that is one of the things he says. He says, and he listed the diseases, the problems in our culture, and said a lot of this is from the overprescribing of antibiotics. I mean, you know, you weren't alive then, but remember back in the like 70s, like, you know, doctors would put somebody on, what was that antibiotic they put people on for acne? God, I can't remember. Tetracycline.
Oh.
And they leave them on it for years.
Yeah.
You know, and then pretty soon, those people would start developing gut issues, and nobody knew it was, they didn't even know that was happening. Nobody knew about the microbiome back in the 70s. Antibiotics they were way overprescribed. I saw it happen. So we didn't know that back then. We do now. So a lot of pharmaceuticals, PPIs, really cause gut issues. Loss of neonatal exposure, like this is like C-section rather than going through the birth canal. That's a big deal. Having a baby naturally does so many good things for that child. Genetic predisposition, you know, some people, I guess, have a genetic predisposition for gut dysbiosis. and then other pathogens such as mold and fungi. So this is the immune system, the hygiene hypothesis. Does anybody know what the hygiene hypothesis is? Well, you can read it, I guess. I don't want to read it, but I'll just tell you about it. So the more dirt and animal dander and pets you're exposed to when you're a child, that actually trains your immune system, the healthier you are when you get older. So people that grew up on a farm, and they're exposed to cows and pigs and chickens and dirt and manure, those people have stronger immune systems than the kids that sit around and play video games all the time in a sterile environment. Okay? My mother grew up on a farm. I just went and saw her in California. She's 94 years old. She's just doing amazing. I mean, she's 94 going on 79. It's true. I saw her, she walks upstairs okay. She can debate you with politics and theology. She's doing great, but she also takes really good care of herself. But she grew up on a farm and ate real farm fresh food growing up. And her mother lived to 99. She might even pass her up. I don't know. I don't know if my mother will ever die, but she's doing well. But she grew up like this. Okay, so there's a guy by the name of Jack Gilbert who wrote a book called Dirt is Good. I've never read it, but he's the one that's saying, look, we need to expose ourselves to germs. That trains our immune system, and so that's why I never use those like disinfectant things that we're supposed to use during COVID. I never use those things. They pass them out on airplanes, and we're supposed to have one up here. And I just, because I want to be, it's not saying I don't wash my hands, but I want to be exposed to germs, okay? It trains our immune system. So how can we support our immune systems? Eat a diet rich in whole food, as much as organic as possible. Avoid foods which damage the gut. Like some of these will damage the gut, especially in some people. I don't do particularly well with dairy. I do terrible with milk. And so, a lot of people have food intolerances. And I was just having a conversation with Lori about an hour ago about sourdough bread. Sourdough bread's actually pretty good for you. What it does is it ferments that flour and it really reduces the gluten tremendously, and it produces postbiotics which actually feed your gut bacteria. So all those things that we talked about with short chain fatty acids, sourdough bread helps that process. Okay, that's which is why I make it, because there are some really health benefits to that. So minimize sugar, alcohol, processed and refined foods. Exercise, we know, enhances immunity, and avoid pharmaceuticals as much as possible. And when you're prescribed one, ask, what does it do? Or look it up. Go online and look under drugs.com under the side effects of the pharmaceuticals. I mean, it's amazing how many people come into me with problems that their pharmaceuticals say are side effects of the pharmaceutical. It doesn't make any sense. Okay, what supplements strengthen immunity? Here's a whole bunch of them. Echinacea, really good. Andrographis and astragalus, very powerful supports for immune challenges. I use andrographis for acute issues and astragalus for chronic immune issues. Supporting the adrenal glands, whole food vitamin C, vitamin D, zinc and trace minerals, and berberine. So berberine is an herb. It's one of my favorite products. What does berberine do? Anybody know? Nobody? Okay.
Isn't it natural metformin? It's a natural metformin.
Yeah, so it lowers blood sugar, natural metformin. It lowers cholesterol, helps manage cholesterol. But here's another thing that it does that I really like. It tends to kill off bad or harmful bacteria in the gut without hurting the good bacteria or the commensal bacteria. So berberine can be an integral part of my gut health program. And I just had a woman that came to me a month ago, and she's a functional medicine patient from out west, and she had all this testing done, really good testing, all this testing, and she'd taken all these products, and she still had gut issues, bad gut issues. And so I just put her on the gut health program, and I saw her yesterday, and seen her for a month, and she's doing great. Gut's really feeling a lot better. She's doing really well. I didn't do any testing with her. I mean, she had thousands of dollars worth of testing. You know, I'm going, you don't need any more testing. You know, you just need your gut fixed. So berberine was one of the things that I gave her.
Where's that come from? Some kind of natural fruit?
Yeah, it comes from a plant.
Oh.
There's several plants that have berberine, like the golden seal plant is berberine, but they get it from other plants too, because the golden seal plant is a lot rarer than, I can't remember where they get berberine from, but sorry about that. I should know, but I don't. I forgot. So leaky gut syndrome, big deal. So when you have gut problems, that where your gut has opened up and it's leaking things into your bloodstream that shouldn't be there, like bacteria and viruses and undigested food. These are products that I give for that, like gut flora complex, berberine, a product called Paradis Biozyme, biofilm complex, which breaks down biofilms, whole food fiber. You know, some of you are taking some of that and if I have somebody that has an autoimmune issue, they get a lot of these, because gut and autoimmune issues are joined at the hip. Okay, so you got to fix the gut. What would be the other thing that you'd want to fix in an autoimmune problem besides the gut? It's a hard question. I should give a prize for anybody who can answer it. What would be the other thing that you want to correct? Anybody? Toxicity.
Oh.
Figure out what toxicity they're carrying and get rid of it. That's the other thing, really important.
Like things they've been exposed to?
Yeah, like the arsenic that I'm carrying around.
Oh.
Things like that, you know. Like, you know, pesticides, GMOs, glyphosate, molds.
Metal fillings. Gotta get
Yeah.
them out.
Well, here's the interesting thing, and I have 4 metal fillings I've had since I was 10. And when I did that toxicity test, I had extremely low levels of mercury.
Oh.
Extreme, I mean, it's one of the least things that I had was mercury. I had those fillings in forever. So not leaking, I can tell you that. So not all mercury fillings leak. I was really interested in finding that out.
Yeah.
And that was like the least of my worries, was the mercury.
Can you flush out that arsenic? Can you flush it out, or does it stay with you forever like lead
Oh,
or something?
oh yeah, you can flush it out. Yeah, I'm doing that with specific products that I carry. And yeah, and I'm not eating rice, you know, because I mean we're eating so much rice at our house, it's ridiculous. That's why I got it. So we're not doing that anymore. And we have a lot of rice stored. I don't know what I'm going to do with that, but anyway. So poor gut health negatively affects the immune function. Here's another interesting study: Chiropractic and the gut biome. They took 3-week-old rats and they adjusted them. Now, I don't know how you adjust a 3-week-old rat. I just don't know that. I was thinking about that. How do you do that? You know, I'd like to find that out. But what they found out was that it changed the microbiome of these rats, made it better. Okay, so that's a pretty interesting study. So call to action. So I'm going to ask you, now that you know what all the stuff about the immune system, what are you going to do differently? Anything? Come on, somebody say less Cheetos at least. You know, I mean, less processed food.
That is so hard, because you go to the office and people got donuts or cookies and they say, oh, we're having a fun time. Here's all your goodies, and they provide all those tweak things that are so good, and boy, that's tough.
Yeah, well, just gotta say no, like Nancy Reagan used to say. So, there is a great test that I just found out about, that, actually, and it's pretty reasonably priced, that actually will tell you what your gut microbiome is, what's going on in there, and if it's imbalanced. It's like $120 for the patient cost, which is really reasonable because, you know, some of the gut tests, most of the gut tests I've had are like between $500 and $700. It's $120, and you can. I don't know enough about it yet. I haven't started using it, but that's one I'm going to start using to assess the microbiome of people and saying, okay, we need to work on this. Okay, here's where you're imbalanced, and here's where we need to work. So I would say this: think about what your call to action is. I mean, hopefully it will be eating whole food, real food, and avoiding sugar and seed oils and things like that, and if possible, pharmaceuticals. So, anybody have any questions? Yeah, Paul.
So when you go in for an operation and they are putting you under, and in their IV, I would assume they're putting antibiotics into the IV bag. So what sort of things should a person be doing either pre or post procedures to get the gut biome back into balance?
Well, that's a great question. Here's one of the things you could do is before you go in, like several weeks before you go into the surgery, a lot of sauerkraut. You know, I mean, that's a really good, really helps the microbiome a lot. So get a good quality sauerkraut and just eat a lot of it before you go in there, and afterwards as well. Excuse me. Another thing to do is take echinacea. Really helps the immune system. Make sure you got, you know, lots of, you know, vitamins, minerals, but for the gut microbiome, I've actually prescribed sauerkraut to some of my patients. You know, I had a patient, I'll tell you, this is a story. She's not here tonight, but this a couple of months ago, she came in, she said, I know what's wrong with me. I have joint pain all over my body. You know, and I've seen her for a long time. So what do you think that means? Somebody comes in, they go, man, all my joints have hurt for the past month. This patient I've adjusted, you know, once a month forever. What does that tell you?
Inflammation.
Yeah, from probably GI somehow.
Cheetos.
Well, I don't think she's eating them, but hopefully not, but anyway, yeah, so she's probably got some sort of an autoimmune thing going on. You know, if all your joints hurt, yeah, it's probably. So I just told her, I said, look, I could sell you a bunch of stuff, but I think what you really need, go home and start eating sauerkraut and see what happens.
But it has to be live sauerkraut, it can't be canned.
Yeah, so you want to eat like something that's cold. I mean, you make good sauerkraut, but something that's, you know, you buy that's
Live culture. That's refrigerated, yeah. So she did. And she went home and ate it for a month. She came back a month later. She's way better. That's all she did. That's all she had to do. Okay? So, yeah, to answer your question, just start eating sauerkraut before and after surgery. That'll help. Or, you know, if you're gonna have to take some antibiotics, you know, eat a lot of sauerkraut. That'll do a lot of things. Feed the short chain fatty acids, give you good probiotics. Yeah.
Here's a question that I've been looking at some stuff in YouTube, and there's this Dr. Davis, and I've been reading about his, it's essentially like, almost like homemade yogurt, but it's got the L. reuteri bacteria. And what can you tell us? Now, I've heard things, but do you have any experience with that?
Not a lot, but I've heard of it. Yeah, and in fact, I'm going to do a talk. I haven't decided when I'm going to do it yet. It's going to be in May, I think, called Talking Back to Ozempic. I'm going to talk about that. And we're going to talk about that bacteria in that talk.
About that bacteria, I did have a health food store person tell me that that's really good for people that haven't been breastfed.
Yeah, it wouldn't surprise me.
Here's spoiler alert on this. I bought one of those yogurt machines for fermenting them for 36 hours, and I bought the ingredients. I just haven't made it. I mean, I literally just got them this last week. So
Okay, well,
it'll be interesting.
Give it a shot. Let me know what happens. Okay.
That's good. Yeah, yogurt, homemade yogurt's really good, just like homemade, sauerkraut.
So can you, like, you're saying just like eat a spoonful of sauerkraut a day? Or
Yeah.
like a whole big bowl or what?
Yeah, tablespoon a day.
Tablespoon a day?
Yeah.
Okay.
Yeah, I mean, you don't have to drown yourself in it. Just a tablespoon is good, so, yeah, that'd be good. Yeah.
I've also heard, and maybe you can enlighten me, that the first thing you put in your mouth in the morning, the first food you eat is what is going to set you up for the rest of the day, and as far as your processing of sugar and all that sort of thing.
Well, yeah, that's true. It sets you up for how your blood sugar is going to fluctuate during the day. Okay, so there's a lot of truth to that. So for me, I'll just tell you, I never eat. I rarely eat in the morning, and I just drink coffee that's loaded with things like coconut oil and butter and essential amino acids and heavy whipping cream, and that lasts me a long time. It's a lot of fat. That's what I do. Okay, I don't generally eat breakfast very often, so that's the first thing. But here's the thing: a lot of people will get up and eat eggs, which is really good for stabilizing blood sugar. It's high in protein and fat, so eating eggs first thing in the morning is really good for that. So if you're going to eat breakfast, eat something like that, or if you're intolerant to eggs, eat chicken or steak or something that's high in fat and protein. So that's really good for stabilizing blood sugar.
Do you buy a bottle of this essential what kind of acids?
Essential amino acids, we carry them here. It's in a powder form. I just put it in coffee. That's how I get them. That's how I use it. It's flavored real nice, so makes coffee taste really good. So that's one of the things I put in the coffee in the morning. Yeah. Okay, anybody else? Good, so
Oh, just out of curiosity, what kind of toothpaste then do you use?
Yeah.
I use baking soda.
Okay.
That's what I use. And, I've heard good, my wife tells me that I'm going to destroy my gums and teeth. And, that's just not true. So I hadn't been to the dentist for a while, and I went, and my teeth were fine. I needed some cleaning and things like that. I just used baking soda for a long time, for probably 20 years.
Because I know a lot of people are getting away from like the fluoride in the toothpaste, but I didn't realize there was more than just that.
Yeah, I just use baking soda. That's all I've used for a long time. And I think it works great. Okay. It's never hurt me. It's never, eroded my teeth or anything like that. And, you guys can, use whatever you want, but that's what I use. Okay.
And we use a recipe that includes coconut oil with the baking soda.
Yeah, that's good, because coconut oil pulls out stuff in your mouth. And yeah, I would agree with that. And I just haven't had enough discipline to do the oil. If you want to know the truth, did it for about 4 or 5 days, then I just I got busy and stopped doing it. But oil pulling is really good. Yeah, with coconut oil. Yeah, something I could do that would be helpful.
How do you find out if you have leaky gut for sure? You think you might, but you don't know.
Do a test. We have a test called the Wheat-Zoomer test, and it'll tell you.
What do you call wheat?
Wheat-Zoomer. It tests all the aspects of the entire wheat compound. So wheat starch, wheat germ, wheat gluten, everything.
Oh.
And then it also tests for leaky gut. It'll tell you exactly, do you have leaky gut and how bad is it?
Oh.
And it's a blood test.
Oh.
It's a fasting blood test. And it'll tell you exactly whether you have it or not.
Oh. Wow. And you do that here?
Yeah,
or?
we do it here. I draw the blood here, send it off. Takes about 2 weeks to get it back.
Oh.
Great test.
Oh. Okay.
Yeah,
Wow.
you can find that out real fast.
Wow. Okay.
Yeah. Yeah, definitely. Okay, anybody else? All right, great, thanks. Appreciate you guys coming out.